Welcome to all the attenders of the 8th International Symposium on Focused Ultrasound. Our study is about thalamic parcellation for target identification in transcranial MR-guided focused ultrasound thalamotomies, and this is a retrospective probabilistic tractography study in patients with essential tremor. These are my disclosures. Anything really relevant? So, as you know, focused ultrasound allows us to perform a functional exploration of the thalamus to confirm and to optimize the target before inducing a permanent lesion. However, nowadays, the targeting is based on atlas-based stereotacted coordinates that do not take into account the anatomical variability of each single patient. And so the final target coordinates identification is based on patient's feedback during low power sonication. And in some cases, this stage of the procedure could be time consuming and the risk is to extend too much procedural times. Not all the patients that we treat are like the one I'm showing you. This is an essential tremor, a patient with essential tremor with a very good skull score. And in this patient, since the best spot for him is very close to standard atlas-based coordinates, in just 8 sonication in less than 2 hours, we had success in giving the patient a great result with a very good clinical outcome. And at intraoperative imaging, we can already see a very good lesion placed where we want to be to see it. But there are cases like the one I'm showing you where the target is not just where we expect to be, especially in patients with these very wide third ventricles. And we had to move a lot in these patients before finding the best spot where to place the lesion. And this is why there are a lot of publications in the English literature that are suggesting to use, for example, dedicated MR sequences to optimize thalamic nuclear identification. These sequences, as always, very unfriendly names, but we don't really think that this is the way to go for target identification during focused ultrasound procedures. Otherwise, we do believe that the use of advanced neuroimaging based targeting is the way to go. And in particular, for thalamic parcellation, the use of diffusion tensor imaging sequences, as in this study from the colleagues from the Mayo Clinics that used some dataset from the Human Connectome project, they demonstrated that it was actually possible to show all the different thalamic nuclei groups that are projecting to or receiving fibers from the cortex in a very elegant way. And the same here, the colleagues from the Stanford University published this paper that is investigating which of the neural circuit best correlates with the focused ultrasound placed at the lesion in respect to thalamus dentate circuit, thalamus motor, and the specific hand knob of the motor area. So the aim of this work is to retrospectively evaluate the possibility role of thalamic parcellation based on probabilistic tractography algorithm for the identification of the VIM nucleus in patients with essential tremor who underwent unilateral focused ultrasound thalamotomy here at the University of Palermo. These are our material methods. We included in this study only 27 patients of the more than 100 patients treated already. All the patients were screened and treated by the use of a 1.5 Tesla GE scanner. And these are the sequences that we used, the 3DT1 for brain segmentation, and we used the free surfer for that. And the DTI sequences was analyzed using FSL pipeline, and the tool that we used for probabilistic tractography is called the ProbTractix, but I will give you more details about it later during this presentation. This is one of the results of the brain segmentation performed using free surfer on the 1 mm isotropic 3DT1 sequence. And about the diffusion tensor imaging analysis, as I told you, we use the FSL pipeline, and in particular, talking about tractography. As you know, we have two different approaches. The deterministic one, that is the one more realistic for clinical scenario. And if you want to know which fibers are connecting point A to point B, using a deterministic tractography approach, that is assuming just one streamline per seed voxel, the result will be a bundle of fibers connecting the 2 points, the 2 seed points. But if we use a probabilistic approach, that is, as you see, performing a multiple sample for each seed voxel, the result is not going to be a bundle of fibers, but it's going to be a probability map where the hottest the color will be, the higher the probability of finding fibers connecting point A to point B will be. This is what we made in Palermo. We used the seed regions, the M1, the S1, and the BA6, and the target of those seeds is the thalamus. We also included some area that are going to be excluded from the tractography analysis to optimize the results. We already validated this pipeline and this analysis on more than 100 datasets from the human connectome project. I'm showing to you the preliminary tests on a retrospective, with a retrospective approach on our patients, and we are already looking at future application with a prospective fashion. These are our results, again on 27 patients. If we plot the distance of the VIM from the ACPC references using atlas-based coordinates, as you may see, there are no difference at all of the target among all these patients. But if we plot tractography-based coordinates, always showing the VIM distance from the ACPC references, there is a huge variability on all the three axes, so on the mediolateral, anterior-posterior, and superior-inferior axes. And if we plot in a graph these differences by showing you not only tract underscore max, that is the distance from the maximum probability point within the probability map, but also showing you the so-called center of gravity, so the distance from the center of gravity within the probability map calculated with the pipeline I showed you, using a 25% threshold. And again, is very easy to find this huge inter-individual variability. And in conclusion, of course, if we go back to the patient I showed you, where we had to move a lot before finding the best spot, and we plot the spot that we hit in the probability map as indicated by this cross, as you may see, there is a perfect match between the probabilistic tractography map and the spot that we hit and where we placed the lesion. So concluding, even if these are of course some preliminary results, but these are very encouraging, and there are some limits. In particular, all the pre and post-processing pipeline are still complex. I'm very honored to collaborate with the physicists from the University of Palermo that are actually performing all these analyses, and these analyses are still very time-consuming. But I believe I showed you that this technique could result very helpful in particular in those patients where the optimal target does not perfectly match with conventional stereotactic atlas-based coordinates. I thank you for attention on behalf of all the colleagues from the University of Palermo, as you may see, radiology unit, neurology unit, neurosurgery unit, but also the colleagues from the Department of Physics and Chemistry, and of course also the colleague from Rome La Sapienza. Thank you again for your attention.